Why do we need to sign up for this program?
Health insurance is important so that when you become ill or just in order to sustain yourself, it's good to have coverage. So you don't have to just go someplace when it's an emergency. So you can keep going routinely, just going to the doctor and getting a checkup.
Now, when you say a navigator, does that mean that you're going to enroll the person that comes to you? Will you enroll them, or how do you navigate for them or with them?
Our role is to educate first. We want to make sure that we have an educated consumer that we deal with. We don't want people to just be picking something haphazardly because a lot of people have never had insurance before. So we try to educate our consumers first of all. And then we allow them to go and make their own decisions about which policies to pick. We want to make sure we deal with an educated consumer first of all. That's our role.
What age group are you trying to reach, or is there an age group that you're trying to reach?
Right now, the healthcare market is set up for individuals between the ages of 19 and 64. It's 19 and 64 because the state of Texas did not accept the expanded Medicaid program, so that's the group that we're looking for.
Okay. Where are some of the locations that you are in Houston? As far as how will we get in contact with you? Give them your phone number again.
My phone number is area code 832-393-4488. I'm located at 8000 North Stadium Drive, which is right around Reliant, the Astrodome. That's where our office is, and I'm on the 3rd floor. And they can call, and then we'll tell them about the different multipurpose centers that we have around the city of Houston that we can refer them to.
Well, you said something, because you do have navigators at the multipurpose centers now.
Right.
So they can go to the multipurpose centers
Mm-hmm.
and have and meet a navigator.
Right.
What department in the multipurpose, or do they ask the information officer at the desk?
They can just ask. We have a lot of brochures set up in the lobbies of our multipurpose centers, and they could just go up the front desk and ask someone about the healthcare marketplace. We're involved with the 12 surrounding counties around Harris County. We're Galveston, Waller, Chambers, Brazoria, Fort Bend, Warden. We go all out. Montgomery County.
What about Chambers, Liberty?
Chambers, Liberty.
Waller, Walker?
Yes.
Okay.
We're responsible for all those counties, and what we're trying to do now is set up networks in those counties so we can start working in there too. That's what we're working at now. We are going out there.
If a group in one of those counties were looking at this program, they can call you and you can help set up a presentation
Yes.
in their area.
Yes.
Okay, so can you walk us through that process if someone is in the audience right now that wants to call? What would happen once they call you?
What they would do is they can call me at my office phone number, area code 832-393-4488, and then I'll send them a link to an email, and then they can.
What if they don't have email?
Well, if they don't have email, well, then I'll just do it over the phone. I'll talk to them over the phone and see if we can make arrangements to do a presentation.
Okay. What are some of the essentials that we haven't covered so far?
Well, the consumers need to really, if they're coming in to apply for the marketplace, they would have to know their income, their W-2 form, the income that they're going to report on their 2014 taxes. And if they have someone in the household besides themselves, they would need to know that individual's Social Security numbers. And then lastly, what they'd have to know is they would have to, if they already have job-based insurance, there's a form that they have to have filled out by their employer. And then they need that information too, because there's a number that the employer would list on there, and then that would help them assisting whether or not they can go to the marketplace and see if they might be able to get their insurance cheaper.
Okay, let's take that, because that's very critical. A person that is coming to this meeting to enroll in a slowed down version, and particularly if they have a job, and you said they have to have a form. Okay, what if they don't have the form? How do they get a form? Because a lot of times when people don't have everything they need when they come, sometimes they don't come back. So how would we, what would be the process after that? Somebody came, didn't have the right paper or didn't have enough paper. how would they continue the process and then not get dropped through the crack?
If a consumer came to our office, what we would do is we would print the form for them from our internet site, or if they were at home and they didn't have the form, then we could just mail it to them. But we keep up with them. We try to keep up with our consumers. We try to call them because we are not allowed to get a lot of information on the consumer, but they can leave us their phone number. So we just periodically try to, check bases with them to see where they are.
So what other groups are involved?
In the city of Houston right now, we have collaborators with Change Happens, Cognoscente, what's another group? Legacy. There are a lot of different agencies that have navigators. And so if we can't handle something sometime, then we call on our partners.
Give us the deadlines. Are there any deadlines? And then are there any extended deadlines?
Right. What happens right now is that consumers that get enrolled by March the 15th, then they'll get service for their insurance for April the 1st. And the way the policies work is that you won't be penalized if you have insurance for if you're not more than 3 months without insurance. And so that's what we're trying to get the consumers enrolled now by March the 15th. But our official deadline is March the 31st. However, after March the 31st, consumers are still able to get enrolled in the marketplace, but they have to have special life-changing instances. For example, if you were to get married, or if you got a divorce, or if you turn 26 and you're no longer on your parents' insurance, well, then those individuals will still be able to come to the marketplace. Or if you retired, and then once you stop your job, your insurance ended, well, then you'll be able to come to the marketplace and still get the insurance.
Give us a little better understanding of how broad and how this penalty works.
Individuals that do not have insurance for after the 3 months, for more than the 3 months, that for April, if they don't still continue not to have insurance, well, they'll be penalized if and when they file their income tax in 2015.
Okay, let me wait right there. January, February, March.
Right.
April 15th. I don't have insurance. I file my federal income tax, and I'm going to get back $1,500. And somebody is going to say, wait a minute, you didn't sign up for the Affordable Health Care Act, and we're going to take how much money?
Either $95 or 1%, whichever is greater.
Stop right there. So if I made $100,000, you're going to get $100 from me?
What's 1%?
Uh-huh. Okay, now, so we got the penalty, but it's 1%
or
$95, whichever is greater.
Higher.
Okay. Now, can I protest the penalty?
You can appeal. There's always an option to appeal. And you can see if you may qualify for exemptions. There are some exemptions.
Let's talk about the exemptions. Now, it's January, February, March, April 15th, I didn't get the insurance. You want to penalize me, but I'm saying I need an exemption.
Okay.
Where do I get the exemption form, and how do I qualify?
You can contact one of the navigators, and we'll go through the list of people who have exemptions, who qualify for exemptions, or else you can call the national number. Or you could check the website, which is healthcare.gov, and the national phone number is listed on there, and you can get information from that website. The website is very detailed. It has a lot of information on it. You can search for a lot of things on that website.
All right, now, can you give us 1 or 2 examples of why or what would qualify me for an exemption?
Yes, to qualify for exemption, there's something called hardship. And for hardships exemption, say, for example, if you got a utility bill saying you're going to be disconnected, that's an exemption. If you had a recent illness, then that would be an exemption. Or if you were an American Indian or Alaskan Native Indian, those are also exemptions.
Okay, what do you mean when you say a water bill or a light bill?
If you have a disconnect notice, then that would show that you're going through some type of hardship.
Oh,
and
so
that would exempt you
so
from
the exemption general category is hardship.
right. That one's for hardship.
Okay.
If you have like some personal things that are affecting you, if you were sick, you got a large a large medical expense that you had to pay, then that would be an exemption too. But of course, these penalties don't go into effect until you file your income taxes in January of 2015. They're not applicable this year.
Oh,
It's next year when you file your taxes in 2015.
that's critical piece of information. So we got time.
Yes, you have time, but however, you have to have insurance either through the marketplace or through one of the direct insurance companies. So it doesn't matter how you choose to get your insurance.
I look in the phone book and I look under whatever insurance companies, health insurance, and I see all these health insurance companies. Are all of them connected to this? Are all of them qualified to write the insurance? Are there specific ones that are qualified to write the insurance?
I'm not really sure which ones are qualified to write them.
Well, when I say qualified, I mean they have an you use the term, they are authorized to participate.
Right.
That's what I mean when I say.
Right.
So how would I know if they're authorized to participate?
Well, once again, you can either contact us or you can go to the website, healthcare.gov. There is a drop-down box on the website, and it tells you, it gives you the option to apply for, just to look at the premiums before you apply. And so different counties have different insurances. So because you live in Houston and Harris County, you may not have the same options for insurance coverage if you lived in Waller County. So that's why we ask for the zip codes, and that will determine which companies offer insurance in that particular area, in that county.
A person goes to the emergency room. What kind of stories have you heard of, or do you know of, or are aware of that would encourage people to sign up?
Well, I had a consumer, and she had a stroke and she had a heart attack, and she was paying the COBRA insurance. And so she was able to get onto the marketplace, and so it was cheaper, less expensive than the COBRA that she was already paying. And she was really happy about that.
Okay. All right, that's one. Now, what about somebody that went to the emergency room and it was just, I don't know?
Well, with the marketplace, your income has to be $11,500 in order for you to qualify for the marketplace. So some of our consumers that may not work and doesn't have any way to pay the premium, well, they would still have to rely on some of the federally funded programs. Now there are a lot of federally funded health clinics that are coming up, and they're there to support those individuals that cannot come to the marketplace. And because at the present time, the state of Texas has not agreed to expand Medicaid, that's why they're putting coverage to make sure that gap that's being filled by someplace. So they have clinics now that have a lot of, based on the scale, that's how you pay.
We're about to wrap up. Give us a closing encouragement to sign up and enroll.
Well, we would like everyone to contact our office at area code 832-393-4488. That's my phone number. If you leave a message, we will return your call. Or we're trying to get everyone enrolled who's eligible by March the 31st so that we can get our area insured